participants in the largest ever study of the popular beverage and its effects on health were divided into 3 groups based on their coffee intake. No coffee, light to moderate and high. 58% of participants were in the light to moderate intake group, whereas 22% were in the no coffee group and 20% in high. The data collected by the UK Biobank, a biomedical database which holds genetic and health information on over 460,000 individuals, found some amazing results. After adjusting for a range of other interfering factors that could influence health, researchers found that light to moderate coffee consumption was associated with a 12% lower risk of death from any cause. Even more specifically, there was a 17% lower risk of death from cardiovascular disease and 21% lower risk of stroke. Michael Parkinson Health, Diagnohealthsys came as a great shock. These findings point to the conclusion that a light to moderate coffee intake can lower your risk of heart disease and strokes. Dr. Judith Simon, of the Heart and Vascular Center at Semmelweis University in Budapest, who presented the research and wrote the report, said, "To our knowledge, this is the largest study to systematically assess the cardiovascular effects of regular coffee consumption in a population without diagnosed heart disease. Our results suggest that regular coffee consumption is safe, as even high daily intake was not associated with adverse cardiovascular outcomes and all-cause mortality after a follow-up of 10 to 15 years. So what is meant by light to moderate intake? Pfizer vaccine, 4 troubling side effects that follow second jab, tips dementia, 3 lifestyle habits increasing your risk, expert advice. Pamela Anderson Health, Baywatch stars death sentence diagnosis, insight. Well, when separating participants into the 3 study groups, those in the light to moderate group drank anything between half a cup to 3 cups a day. Those in the high intake group drank more than 3. Dr. Simon continued to say, moreover, 0.5 to 3 cups of coffee per day was independently associated with lower risks of stroke, death from cardiovascular disease, and death from any cause. In order to monitor the link between coffee consumption and heart structure, researchers used MRI scans. When compared to those that did not drink coffee regularly, daily consumers had healthier sized and better functioning hearts, said Dr. Simon. The precise reasoning behind this reduced risk is not known, yet Dr. Simon suggested that it might be partly explained by positive alterations in cardiac structure and function. Cardiovascular diseases, CVD, can come in multiple different forms. However, the 4 main types include heart disease, strokes, peripheral arterial disease, aortic disease. All 4 affect the heart and/or blood vessels and can be extremely damaging to organs like the brain, heart, kidneys and eyes. Although drinking coffee is not one, there are a number of risk factors involved that might increase your chance of CVD. These risk factors include smoking, high blood pressure, high cholesterol, diabetes and being overweight. Therefore, some healthy lifestyle changes such as increasing exercise and reducing the amount you smoke can also reduce your risk of CVD. Related articles: Heart disease symptoms, 5 subtle signs on your skin. Single most important dietary tip to reduce risk of heart disease: how to live longer, daily habits to boost longevity.